Well, let's do some introductions. Who am I? I'm a board certified internist. I'm a board certified obesity medicine doctor. I'm also a certified trainer, um, health coach. I have a practice that's nationwide. We have 4 health coaches, personal trainer, 2 doctors. Well, you'll meet one of the health coaches. I'm a board member of the SMHP, and I'll tell you why that's important. I lost 150 pounds, and we lost power. So that's 2 things. Oh, we're back. Okay. So I'm going to run in a 5K. The reason why I'm presenting first here today is because I have to go to a charity 5K, and I went from sick and every joint in my body hurting, and to loving to run and loving to move my body. And so that's why I'm so passionate about this. I want to share that with everybody. And interestingly enough, I met somebody earlier today who had the same experience I had. I went to my doctor and I had an A1C of 5.9, and the doctor said that's completely fine. And I had a triglyceride level of 149, and they said, oh, that's completely fine. And my HDL was 20, which is very low, and they said that's completely fine. So, and they told me, why don't you count your calories? This I trained in the Yale system in this area, Greenwich Hospital, Yale. That's where I did my internal medicine training. I was chief resident, and I would talk to the leading cardiologists and leading endocrinologists, and their response was just look at the label and count, which is, in uh, my opinion, pretty pathetic. So that's why I'm passionate about actually helping people, actually helping them where they are. We've helped 2,000 patients lose over, it's actually nearly 100,000 pounds now. We have 11,000 people on our smartphone app, and I'm just gonna, oh, this is one thing I want to talk about. This is the preposterous clown world we live in. Um, the American Academy of Pediatrics, and when I'm talking about medicine, says, and I think rightfully so, they say, look, if somebody is struggling with weight, you know, you should, as a doctor, not discount the idea of surgery and not discount the idea of medications for people who are really struggling. And I thought that that was, a pretty reasonable recommendation that the American Academy of Pediatrics made. And then it was followed by a preposterous recommendation in September of 2023, which was if you have a child with obesity and you want to lower their sugar and lower their carbohydrates, they said you need to do 20 blood tests and get an imaging study to do that safely. That was their guideline. So this is not a joke. This is our Academy of Pediatrics, the American Academy of Pediatrics, and they're all about liberalizing sort of surgery on children and hormonal treatments on children, which have a place in medicine. We should not say that they don't, because they do. And yet, if you want to stop Coca-Cola, you need, 20 lab tests. And so this is why I'm passionate, because we're all here. We understand the tenets of metabolic health. Nobody raised their hands when she said, is anybody new to keto? We understand it. We understand we need to reduce processed carbohydrates and sugar. But the rest of the world hasn't caught on yet, and even our Academy of Pediatrics doesn't. So I write letters to the editor. I write to them. Sorry, can you guys hear me? Is that a little bit better? I write letters to the editor saying, this is a joke. You guys are a clown world, and they don't publish it. So we went to another journal and we actually published it, saying your guidelines are, I don't want to say corrupt, but they're not fair. You're discounting the things that we know we need, which is to focus on nutrition and diet and lifestyle, and yet you're promoting surgery and medications as a first line, and that's not appropriate. So this is why I'm passionate. This is why I'm here, and this is why I get riled up. If you follow me on social media, you know that I can get a little feisty because we're all vulnerable. We are luxury cars, right? And the additives they put in food, the maltodextrin in our electrolyte drinks, the processed carbohydrates that they put in egg bites, we are under assault. right? The commercials, the guidelines from our prized medical organizations, right? We are under assault. And so I think we have to be vigilant. And I love that metaphor of the car because I think it's the most important. We deserve health. Everybody in here deserves health. That's my passion. Um, we have a paper that we submitted where again, we use these medications in our clinic, so I'm not discounting them, the Ozempics, the Manjaros, but in a large employee wellness program, we were able to stop Ozempic as equally as we started it, and we still had a 15% weight loss, which I was super proud about, and we just submitted this paper. I'm going to try to fix this mic, guys. So this is me, 10 years of keto. This is what it looks like. I don't know if you can see this picture here, and this is my wife who's here, who I love, and yeah, Rosette. Yeah, she supported me. And this is what removing an addictive substance does in two different people. You can see, removing an addictive substance in me caused a 150-pound weight loss. And you may not see this, but in my wife, she had a 20-pound weight loss and she lost her migraines. So metabolic health presents itself in a lot of different ways. So, and a lot of people, look at me, they see me speak and they say, Tro, but really I have to give a quick thanks to my whole team. One of the health coaches will be talking right after me, and the other health coaches here in the audience, Vic. It takes a village, it takes that team to make great care happen. And what is it that we do in our clinic that's so special? Text messaging, online visits, wellness coachings, and trainers, asynchronous education. We use an app. We use real-time feedback. Everybody should be using a CGM at some point or ketone meter if they haven't to get real-time feedback. And we use dietary modifications that support metabolic health, whereas the AAP says, maybe count your calories instead of lowering your carbs. This is what that looks like and feels like, and I'm just going to pass through it because you guys don't need to hear about that. And I'm going to get to the meat of the topic that I want to talk about today, which is food addiction. We all want to maintain a healthy lifestyle forever. We all recognize that we have this Lamborghini or we're a luxury car, and we all know that our body needs great inputs. Who here knows that they have to eat healthy? Yeah, everybody, right? Now we have to take knowledge and turn it into practice. So how do we maintain this healthy lifestyle forever? Who has maintained a healthy lifestyle for a long period and then really struggled and gone off the wagon? Right? Everybody. And who's done that many, many times? Right? Everybody. So the problem isn't so much an education problem, it's how do we remain committed to this lifelong journey of treating our body like a luxury car? That is really what most of us care about. How do we go from we understand what the ideal is to we do it? And the truth of the matter is we all do it in other areas of our lives, maybe our businesses, maybe our cars, maybe our bank accounts. So how do we translate that into our lifestyle? And how do we reduce suffering? That's basically what we're looking for. Like, I just want freedom from food. I just want to eat healthy foods. I want to move my body and feel good. And that's what we're all after. So how do we do this? And this is what the voices of suffering are. I'm really sorry here. This mic is acting up. But I just can't do it. And raise your hands if you've just said this. I just can't do it. Yeah. And I don't have the willpower. Right? I said that. I don't have the discipline. Right? I'm a chocoholic. I don't know if anybody said that. Yep. Yeah. I just can't stop eating bread. Right? And it applies to exercise too. It's not just food. Like, I just been off plan. Right? I haven't been to the gym. Right? So there's voices of suffering. It's my fault. It's just me. I don't know why. I just can't seem to do it. I need to do better. I don't have the discipline. Right? So what is the best model that explains our obesity epidemic? Is it the budgeting model? Are we not, is it a calorie problem? Could it be that maybe the food addiction model is a better model to look at our lifestyle and metabolic health epidemic? And so what is food addiction? It's basically the strong hunger and drive to eat. It's a manipulation of your mindset, right? So who has, and I'll give you a quick little example of it. Who drove here today? Everybody. Okay. So if you got a flat tire right now, how quickly would you all wait to get help? 5 seconds, right? About 5 seconds. If you ate something off plan and you've struggled your whole life with food, how long would you all wait to get help? So you treat your luxury cars much better than our body, going back to that example, right? When it comes to our luxury car, it gets immediate help. And yet something happens in our brain when it comes to our lifestyle, when it comes to our exercise program, when it comes to our diet, it doesn't get that immediate attention. So there's this manipulative process when it comes to lifestyle, and other things don't get it. You all, I'm sure, have bank accounts. If something's wrong with your bank account, how quickly do you all call the bank? 2 seconds, right? Even quicker. And when you've been 1 week off your exercise plan, how long until you call for help? 2 years, right? If you've been off your eating plan, how long until you get help? Maybe your whole life. Maybe you never have. So this manipulation, right? This is one of the hallmarks of food addiction. It's not just that. Food addiction then means there's significant psychological and emotional distress. Like this distance between how you treat your car, your money, your bank account, other things that you care for immediately, and your own health is so great that it's causing you emotional and psychological distress. And these are the hallmarks of a problem with food. And I'm going to be talking about that significant distress today. So my goal today is to give you a tool to reduce the psychological distress of yo-yo dieting, diet cycling, decision fatigue. Who's seen any of these, right? Just so tired, right? We've all seen these. And take a picture of the slide. If you struggle with anything, this is like the cheat sheet. So this is the one you could take home and study and read. If you want to address lifestyle forever, it's 10 things. Okay, 10 easy things. You must have a way to manage your hunger. You must manage your cravings. You must know how to deal with your feelings of deprivation because everybody else is going to be eating KFC and chocolate and you're not. So we need a way to deal with that feeling of deprivation. You must, how many people here have, has their diet and lifestyle gone to the grave after a holiday, business meeting, vacation, birthday party, right? How many times does that happen, right? And you're like off plan forever. So you must manage social situations and you must manage emotions and coping. You lost somebody, you're under financial distress, your relationships are suffering, right? You're having marital problems, right? Somebody, you're moving. How many diets have gone to fail because of the emotional issues related to these fish? Everybody's nodding their head, right? So if you want to maintain your diet forever, these are critical. You must address them, right? And how does that turn out to? What must you do when it comes pragmatically, right? If you plan for these 5 musts, you will be able to manage a lifestyle under any scenario. If you know how to maintain your diet and lifestyle program through stressful situations, through sleep deprivation, in very triggering social situations, holidays, parties, you know how to deal with your own feelings of deprivation, you know how to manage your cravings and hunger. Here is a list of things you need to tackle to do this forever, right? And then pragmatically speaking, what does that mean? Well, what foods do you struggle with? What times do you struggle? Where are the places you struggle? We're all creatures of habit, right? And who are the people you struggle with? And the one concept I'm going to talk and focus on here is the 10th and final thing that I think everybody needs is immediate recovery, right? Immediate recovery. How do you recover immediately? Why should you recover immediately? Why should you not delay? Why you shouldn't delay. And so take this. If you do these 10 things, I don't think you'll struggle with food. I mean, you may struggle, but it'll be manageable. I don't think you'll struggle with your lifestyle. It'll be manageable. So this is the cheat sheet, and we're going to be talking about recovery today. And pragmatically speaking, we've done this in 2,000 people. What does that look like? It's 30 to 55 line items. How do I manage my hunger? How do I manage my cravings? How do I manage my feelings of deprivation? How do I manage my problem, people, places, social situations, right? The times per day, the emotional straits. If you take the average person and you map out their struggles, it turns out to be 30 to 55 things. So that's it. To keep your lifestyle program forever, it's about 30 or 55 things, right? What foods do I struggle with? What foods do I always go off plan with? What situations do I stop my exercise plan? When I was visited by Coach Bronson and Coach Natalie, first thing they asked is, where are we working out on Sunday? Right? So they know they struggle when they travel, but they made it a priority, knowing that they struggle with travel, to put their lifestyle first. Right? They knew the food was taken care of. I mean, Rosette made 6 racks of ribs and 12 pounds of brisket. But we are all creatures of habit. So this is another slide you want to take a picture of, because your journey maintaining it lifelong is 30 to 55 things. It is manageable. It is doable. And the one we're focusing on is immediate recovery here. So what will be more important to maintaining, I'm going to skip this question, but everybody thinks, they need more responsibility, more accountability. And it's true. Half of us do. But equally so, we need to understand exactly what it is we're fighting against. Why do you treat your car differently than your lifestyle? Yes, you need to treat your lifestyle differently than your car, right? With the similar, let me try that one again. Yes, you need the discipline and the willpower and the accountability to treat your lifestyle like you do your car, like you do your bank account. But the real question is, why don't you? Why don't we treat our health like that luxury car? Why do we put our health second when other things that we really don't care about, like our car and our bank account, like they can go to hell if I have a good life and my family's healthy and I'm healthy? I wouldn't care about them, right? And most of us here probably would make that same decision. And yet, when it comes to our health, we put ourselves second. And why is that? So I want to talk about that idea. I'm just going to put my thing here like this, because it's just, I want to talk about immediate recovery. You have that list of 10 things. There's a concept in medicine, and I see a good doctor here and a couple of good doctors here, Sean and Alan here, who there's a concept and they know in medicine, and it's a phrase. It's called time is tissue, which has some applications in stroke or in heart attacks. So if you were to have chest pain, if you were to feel like, pain going to your shoulder, your face, you have been educated, and your doctors have been educated to understand that that could be a heart attack. And they know to tell you, you need to get help right away. So if you all had chest pain right now, what would you guys be doing? Call 911, right? You'd get help. Or if I just all of a sudden had a droopy face and one side of my body stopped working, what would you guys all recognize? Stroke, right? And you guys all know what I should do right away. What would you tell me to do? Call 911. And how long would you all wait to call for help? Yeah, 2 to 3 months. Yeah. Yeah. How long would you wait? Yeah, not 2 to 3 months, right? So we call right away. Why is that? Why do we call right away? Because time is tissue. If you let me with my droopy face and you let me with my weak arm, that clot is going to cause permanent damage in my brain, right? And that would cause a stroke, and I would lose function, and you would know that you have to act quickly. Same thing with the heart, right? If I have a heart attack and there's a clot in one of the arteries in my heart, and I was having chest pain, I was on the floor, you guys would get me help right away, because you know if that clot's over, right, that my heart is going to become weakened. And so we all know as a medical profession, right, time is tissue. We all learned that, right? So we get help right away. The patient is educated to get help right away, and the medical teams recognize this, and they move on it right away. So can we bring this over to the realm of lifestyle? And when prevention is not guaranteed, right, we can't always prevent a heart attack. There's pollution, there's genetics, there's microplastics. You cannot get away from damage to your your endothelium. So sugar, namely smoking, right? Those are the biggest insults. So when prevention is not guaranteed, we need to educate patients how to increase their chances of intervening really quickly. We don't want them to delay. We want them to get help right now. And the earlier that intervention is done, the less damage is done. So the goal is to approach moment zero. And if you waited months, Mr. Salty, what would happen is you'd get a big area of dead tissue in the brain, and that's a stroke. And so we don't want that. We want to get to that moment where the symptoms start so that the tissue doesn't get damaged. And, the question is who is the person who gets help right now, right? Who is the person who waits hours? And who are the people that wait days or months? Because those are real people. We see it all the time. I'm sure Sean remembers his days in the ER, right? When you'd see somebody come in and like, why didn't you come in 3 hours ago? Right? You're an ER doc. Did I make that right? Yeah, yeah. They would wait days. Or they, come in with heart failure because they had that chest pain and they just said, oh, it's fine, right? So who are those people? What are the factors that lead patients to delaying getting care? Lack of knowledge, lack of awareness, stress. Maybe they had something going on, right? There's a hurricane, they're foreclosing, whatever it is, denial, right? I don't have a problem, you know? Self-sabotage, maybe. Poor mental health is a big reason. I'm sure he's seen that in the ER, right? Of reasons why people delay getting care. So how do we bring this to lifestyle? And gosh, I have 7 minutes and I've talked so much. So just remember, time is tissue. And when it comes to lifestyle, time is tissue. Go back to that picture where you saw me 150 pounds heavier. That didn't happen. That happened because I wasn't aware. I was in denial. Maybe a little self-sabotage. I didn't have a supportive environment. I didn't have great mental health, right? And so I delayed getting care. So when you're thinking about your lifestyle when it comes to diet, you do not want to delay getting care. If you delay, time is tissue. You will accumulate visceral fat tissue and you will accumulate adiposity. If you delay getting back to your exercise program that you've stopped for a week, right? Time is tissue. You're going to lose that muscle. You're going to become less metabolically flexible. So can we take this model of moment zero and time is tissue that we use in other aspects of healthcare and translate it into our metabolic health crisis that Christina talked about? Yes, we can. We need to educate each other, right, that the time for our health is right now, that we deserve health right in this moment, that, if you get off plan for a little bit, go back on plan right now. Don't wait. So you have to understand what you're up against. I mentioned this, metaphor to other things that we care for immediately, right? And these aren't things that matter. Who cares if your Corolla has a flat, it doesn't work, right? It's your body, it's your health. And yet, when our Corolla gets a flat tire, immediately we're calling for help, right? And, even our banks, if you look at our banks holistically, who here has gotten an alert that, hey, there's fraud in your bank account, right? So think about how poor our medical system is. We can't even compete with AAA. We can't even compete with banks. Who's gotten a call from their doctor like 1 week, they've been off plan, haven't been exercising, that, hey, how's it going? Are things on track? Has that ever happened here? What a shame. What a missed opportunity, right? So we, as a healthcare profession, have to change, but we also need to sort of invigorate our patients to join us in that change. So if we've struggled with food for years, decades, or a lifetime, why would we wait to get help? Everybody here raised their hands when they said, have you struggled, right? So why would we all wait to get help? Why wouldn't we get help right away? This is an important question. Why do we keep eating off plan? Why don't we get help immediately and go back to our vision of ideal health? These are probably the most important questions. Why do we allow one less than ideal snack turn into months off plan? Aren't these the most important questions we can ask? Right? This concept of immediate recovery needs to be in your armamentum. I must recover immediately. I must get back to my lifestyle immediately. I must get back to my intermittent fasting immediately. I must get back to my sprints immediately. To Dr. Sean. Um, so the primary and ongoing goal, obviously, is to make the best choices. We have a couple of things in our practice that we use. If you're really food addicted to the hyperpalatable food environment, replace what you can't restrict. Start with a dark chocolate if you're doing chocolate. Start with a bread that Maria Emmerich's recipe is, world famous, and she's here this week, right? Or yeah, I didn't see her, but uh, okay, yeah, she's got a great recipe for bread. So if you're stuck on bread, go to her recipe. Um, Use that spare tire analogy if you're hooked on the modern food environment. Learn how to eat at restaurants, right? Like I pull up to McDonald's, I get, it's not the greatest meat, but when I'm in a bind, I get 4 hamburger patties. I posted it on social media. You need these tools to work towards your ideal. Um, and then, your ideal should be crystal clear, real food, meat, and vegetable. But what happens when you're not at your ideal? We're human. We want to indulge. We're human. Mistakes happen. It's expected that we will make human choices. It's expected that we will have some difficulty. Gosh, we just have a ton of patients in the North Carolina area, and they're facing some adversity right now. And we have people, we have a huge company we take care of in Louisiana, 100 patients or so, and they're anxious right now. And yeah, their stress is going to lead them to seek comfort, right? So we make mistakes, but how do we recover super quick? And when you're in Rome, when you're traveling in Italy, when you're going to France, when you're visiting Armenia, who knows where you are, right? You're gonna try the food, so things are gonna deviate, right? But how do you recover quickly? And one thing I've learned in my 2,000 patients and over a lifetime of my own struggle is getting close to that moment is the most important thing you can do, right? It's more important than anything. Do not delay the suffering, right? If you get back on plan right away, you're going to be a much happier person, and we call that moment zero. And I'm going to use a case in the next 2 minutes I have. I may go a little over. Hopefully, that's okay. But here's a 40-year-old. This is what it looks like in a clinical practice. A 40-year-old male, terrible back pain. He's got diabetes and weight issues, and he's got disc disease. And previously, he would put a lot of pressure on himself if he would deviate, and he would lose himself to all or none thinking, right? Who's ever done that? Like, I made a little off plan. I might as well blow this weekend and start again Monday, right? Very common, right? What's happening? What does that mindset do? It delays getting back, right? It's this lack of awareness. So this was him. He would say, I already blew it. Might as well go all out and start again over the next week. And without moment zero, he would struggle 30 to 50 times per year. And this is pretty typical. The average person is going to struggle with their lifestyle 30 to 50 times per year. And the average person will have 3 to 7 days off plan. Doesn't this seem like normal for you all? Yeah. Right? So just think about what that means. Minimum, he's struggling 4 months out of the year, three or 4 months. But it could be the whole year. If he struggles 50 times and he's off plan for 7 days, his whole year is shot, right? And this is what that looks like. 2 steps forward, 2 steps back, right? And the way we look at it, the way a lot of us judge our metabolic health journey is weight, but it could be the blood sugar meter, it could be your overall health, it could be how you feel, it could be your migraines, Rosette. It could manifest in a lot of different ways. But besides the weight on the scale, he was miserable. He was absolutely miserable. If you got to yank me out, you yank me out, okay? 2 minutes, okay? So, well, what happened when we talked to him about this concept of moment zero immediate recovery? He still had the 30 to 50 struggles per year. You're not going to take away the human element. You're not going to become, we're not going to become omnipotent gods, or we could just make, every struggle perfect. He still struggled, but it came 30 to 50 meals off plan or a snack off plan, right? And off plan for him was not real food, right? Maybe he had dark chocolate, right? But the one thing he did was immediate recovery. He did not delay that suffering. He did not go off plan for 3 days. He did not wait for the weekend. He did not wait till next month. He didn't wait till he saw me. He didn't wait to get help. And he had 0 further days eating off plan. And he dropped the shame, the guilt that weighs us down like anchors. Okay? And practiced really radical self forgiveness. And this is what that looked like. 21 times he had some blips on the scale. And this is a remote monitoring technology we use. And he still struggled. But the struggling wasn't prolonged. He called us. He immediately reached out. We reached out if we saw some water weight issues on the scale. And we said, what can we do? How can we help you? So positive. And his distress over food drastically decreased, and he lost a lot of weight. So this is moment zero, battling anything. And I'm going to stop here on this slide. Anything that extends your misery, anything that prevents you from getting back on track right now, this is what you need to battle. This is a key battleground to maintaining a healthy lifestyle, to treating yourself like a luxury car. It's getting back right now to your exercise plan, to your sleep routine, to your food, to your light environment, to practicing gratitude, to the sprints you do, you know. It's committing to keeping yourself healthy and not letting any some small deviation prolong the misery. It's not worth it. And that's it. Yeah.